Namaste India, good afternoon, my dear friends. Today's topic is on how to use a pulse oximeter. What is a pulse oximeter? A pulse oximeter is a small portable device that is used to measure the oxygen saturation levels and the pulse rate of a body. How does the device look? It's a small portable device like this. Now, what principle does the oximeter work on? It works on a very simple principle, that is absorption of light by the blood, which helps in measuring the oxygen saturation level. Next, what are the factors that can give an inaccurate reading on a pulse oximeter? The first factor is when you shake your body or the finger when the device is placed onto your finger can give you an inaccurate reading. 2. Presence of a nail polish or a henna on your hand can also give you inaccurate reading. Reason being is because these layers prevent the absorption of light by the blood, which will give you an inaccurate reading. Next, any kind of skin pigmentation. Then, presence of bright light while using a pulse oximeter also gives a false reading. Now, what do we do if we have a nail polish on our fingers or a henna? In case of a presence of henna, what we can do is we can place the pulse oximeter on the toes of your foot, or you can also place it on your earlobe. But in case of nail polish, there is another way. You can place the finger laterally like this. Okay, instead of placing it straight, you can place the finger laterally like this, which can also help in measuring the oxygen saturations level. Now, what is the normal value of oxygen saturations level in our body? It is 95% to 100%. Any factor below 94%, kindly call the doctors immediately on your list. Or any reading below 90% calls for an alarm call. That is, kindly visit the nearest hospital as soon as possible. And what's the normal pulse rate? It ranges from 60 to 100. But my dear friends, remember these two factors also depend on the age of the patient. So kindly keep the age also in mind. Now, which finger is the best finger to measure the oxygen saturation level? So the studies or the journals say that the right hand, the middle finger of the right hand and the thumb, the middle finger being number 1 and thumb being the second, gives the best reading of oxygen saturation level. But my dear friends, don't worry. The studies have also shown that when oximeter is placed on any finger also gives us an accurate oxygen saturation level. But the best finger would be the middle finger of the right hand. Next, which position is best to measure the oxygen saturation level? Definitely, it's the sitting position. My dear friends, again, don't worry if you are measuring the oxygen saturations level when the patient is lying because he or she is not keeping well or not able to sit. You can still measure, but the best position would be the sitting position. What are the things that you're supposed to do? You are supposed to make sure that the pulse oximeter fits the finger tightly. Okay, it should be fitting tightly. It shouldn't be loose so that it falls, or it shouldn't be too tight also. It should be nicely fit. Next thing is, when you place the pulse oximeter onto your finger, kindly do not shake or shake your body as well. Keep the pulse oximeter for 30 seconds and then you will get a reading. So I hope I could help you out and I could teach you something about pulse oximeter today. So guys, take care. I'll see you all tomorrow. Goodbye.